Access is an extraordinary community health center. And a community health center is kind of a simple term, but Access Community Health Centers has taken it to a whole nother level.
Access cares for patients in the community who actually really need to see a doctor but do not have access to one.
We have a priority to serve people that don't have insurance and people that have Medicaid and Medicare.
When you walk into Access, you know that you will be greeted as a person, and not only will someone be there to help you, but they will also be there to help you help yourself and your family.
The board of directors for Access is truly a diverse group.
8 of the 12 board members are actually patients at Access Community Health Centers. It's very important that patients have a voice in determining the decisions that influence their health care.
And our patients are there with us at every point in the conversation to make sure that we're holding true to that mission of being truly patient-centered.
Access Community Health Centers is unique because it looks at the patient as a whole.
They're pretty comprehensive. They are real big on preventive care, and they are real good at taking care of the medical needs of the patients.
I think that Access has been quite innovative. The ability to see patients in the same facility for not just their medical needs, but also their dental needs and any mental health issues.
You know, to have a place in your neighborhood where you can go and feel respected and feel like you're getting quality health care and feel like you can, get dental care, get, behavioral health care if you need it, is huge.
Access started because there were a number of compassionate physicians in the Madison community that really wanted to make sure that people who didn't otherwise have access to care because they lacked insurance or other circumstances had access to care. To consider the evolution of that little house on Willie Street, moving into new, high-quality clinical space, becoming a federally qualified health center, becoming 5 different locations, serving thousands of patients today in the highest clinical quality, with the highest cultural compassion, and the most competence, is an extraordinary feat.
Access serves approximately 15,000 medical patients and 14,000 dental patients.
One of my most favorite things that Access does is the Celebrate Smiles program, which is unique in our community. Last year, over 2,400 children were served.
The Celebrate Smiles program embeds itself in our school system, and to me that takes away all the barriers.
Madison it's an amazing town. We have a lot of, economic means, but at the same time we have a lot of people that are struggling to get by, that are working, 40, even 80 hours a week, that don't have health care, that can't make, ends meet. And if they need something like a prescription, if they need to go to the hospital, that's very challenging for them.
It's because the people who feel comfortable coming through the doors, there are people who don't get access to health care or mental health care or dental care, who don't feel love and support and welcoming in other places that they go. They have barriers, whether they're because of finances or culture or race or literacy, and they know that when they go to Access, there'll be services for them. And it's not just about services, right? You can't program people out of poverty, but there's also the issue of making sure that you have supports in education, income, and health. And if you have health, then you're able to be more successful in education, more successful in work, and ultimately get on those pathways out of poverty.
But providing equity and access to health care is a basic human right. People can't take care of their families without access to health care.
As a society, we are as healthy as our most vulnerable people, and if there are people that don't have insurance, that don't have health care, that affects us all, and it certainly affects them. We're here. Our doors are open, we're serving, and so, as long as there's a need, I feel like there'll be community health centers, because there's people that need care, and there's providers that want to give that care, and there's definitely a way to do that.